hear me?
Hey, Bill, how are you? Yes, I hear you. Do you hear me?
Excellent. I do.
Wonderful. All right. This talk is being recorded, and we're going to get some live listeners in a few seconds, but I think we can get started.
Excellent.
Good afternoon, everyone, and thank you very much for joining us for another Survivor Aorta Chat interview as part of Aortic Disease Awareness Month. My name is Adam Ahmed, and I'm a fourth-year student at CUNY. We're very excited to have Mr. Bill Barnhart on the line with us today. Bill is from Herndon, Virginia, just outside of our nation's capital. He's been a member of Aortic Hope since its inception, currently serving on the board of directors and as a liaison to the connective tissue disorder community. His first dissection was in 2002, and then another one in 2019. In large part due to Marfan syndrome, he has also had multiple aortic aneurysms. Outside of his advocacy for aortic disease patients, his days are spent enjoying a multi-decade career in the wine and spirits industry, attending local car shows, and most importantly, spending time with his three wonderful children. Bill, how are you doing today? Thank you so much for joining us.
I'm doing great. Thank you so much for hosting me, having me on.
Appreciate it. So, can we start off a little bit just hearing about your story, your experience with Marfan's and aortic disease, and sort of what led you here to this point?
Yeah, definitely. So, I was actually diagnosed as a child with Marfan's as a result of very common subluxated lenses in my eyes. I actually grew up when I was very young. My family lived out in Minnesota, and the doctors there didn't even think about it. Just said, he's a little slow, he'll be fine. We moved to DC. Uh, Someone had recommended this wonderful eye doctor who looked and said, no, the kid's blind. He's smart as a whip, just can't see what he's doing. Let me take his lenses out, get him some glasses. And this really looks common. It looks like Marfan syndrome. You should go talk to my buddies up at Hopkins. I work with a doctor up there who's seen a lot of this and was able to get me with Victor McCusick, who was essentially wrote the book on Marfan syndrome. And from there, they started monitoring my aorta and looking for any growth or measurement, and just taking care of me as a aortic patient for years until 2020. Uh, 2002, when I was at work. I was in a heated discussion with someone, and it felt like I got hit in the back with a flaming pickaxe. Didn't know exactly what it was at first, but I knew it wasn't good, so I ended up calling an ambulance. And as soon as they got me to the hospital, they knew it was over their head and sent me to a trauma one center that right away said, dude, we're dealing with an aortic dissection.
Wow.
It was it was very lucky. It's to be in the area that I am in, and the wealth of medical knowledge in this area, that right from being 3 and 4 years old, they were able to look and say, this is something we need to start watching. Um, and to give you an idea of how quickly and unpredictable a dissection can be, so that first one was April 15th of 2002. April 15th of 2019, I had a CAT scan, or it was my CAT scan that I do every couple months every 6 months because of my extensive history. Was driving home from the hospital and had this horrible pain in my back, and I knew right away what it was. I called the doctor and told him, hey, I just dissected. He says, no, wait, just dissected. You were here an hour ago. And but he wisely knew to follow my lead, and I drove myself down to the next closest hospital. We'd already coordinated. I went right in, and they got me in a CAT scan, and realized that 17 years to the day after my first dissection, I had another one.
Wow. And you're saying that when the first one happened, you kind of weren't sure what it was, but then the
I
second time you knew?
The second time I knew exactly what it was.
Mm.
I actually got to the reception desk at the emergency room. I walked in wearing an Aortic Hope t-shirt. Said survivor across the back, and told him I was having an aortic dissection. I said, nobody walks in here having an aortic dissection. What makes you think that? I said, well, I have this ripping pain in my back, right along my spine. I pulled over and I took my blood pressure. It was different in both arms. I have the upset stomach, the lightheadedness, and it feels exactly like the last time I dissected. And both of them quickly looked at me right away and went, excuse me? The last time? It's like, yep, the last time. They don't just give these shirts out to anyone. And they sent me directly into the back. And thankfully, the triage team there knew exactly what to do. It was a Nova Fairfax, and I cannot be more thankful for how quickly they reacted. And they got me in a CAT scan almost immediately. A surgeon was already on his way down. That was in large part because we'd already called them and told them I was coming. So my surgeon from Johns Hopkins had called down and told him to be on the lookout. And they were able to just react quickly, calmly, and beautifully. They did not have to crack my chest at that time. They actually did it very similar to a TVAR and put a stent in to help stabilize me, with the idea being that the stent would be in possibly a couple days, possibly a couple months, and we just cleared 5.5 years, or we're about to clear 5.5 years. I get it checked every 6 months, and it's holding very strong. It's probably holding stronger than, well, definitely holding stronger than the natural tissue.
It's remarkable.
Yeah, we know there's a good chance I'll have to have it replaced at some point, but up until, as long as it's holding strong, it's the elephant trunk area of the aorta, so it's a very difficult section to replace.
Right.
The rest of it's actually been replaced. My initial dissection was from my diaphragm to my iliac arteries, or I'm sorry, to my renal arteries, and then I had an artificial valve put in and the root replaced because of a aneurysm. A couple years after that, I had a hernia surgery that had gone very wrong because of my body reacts exceptionally well to Lovenox and some other blood thinners. The hernia mesh folded over my internal abdominal wall, and over the course of 5 days, I lost over a third of my blood volume to internal bleeding. They couldn't figure out what it was initially, so they ended up essentially quartering me as an exploratory surgery. The belief was, based on my medical history, that was probably something aortic. But once they got in, they realized that it was just this hernia mesh that wasn't able to heal over because of the me reacting so well to blood thinners. That led to 6 more surgeries that summer and a wound vac to end up sealing up my whole abdomen. 2 years after that, I guess it was a year after that, I woke up one morning with 104 fever. And it turned out, I've dealt with sepsis before with endocarditis. Years before, I guess it was 97, I had endocarditis on my mitral valve, and they were able to treat it medically instead of surgically. But I lived in the hospital for 8 weeks. on IV antibiotics. Um, I recognized the symptoms right away. And my wife at the time, as she's driving me to that hospital, asked me what was happening. And I told her flat out, I said, I'm dying. My body is shutting down. And I don't know why, but it is. We got in and they were able to identify that I had a staph infection growing inside of my heart.
Mm-hmm.
Transferred me up to Hopkins, where the way the surgeon described it was he cut my heart in half like an orange and cleaned the pulp out of it because staph creates it's a mean little bug,
Yes,
and
it is.
yeah, it creates a little like gel force field around itself, which is what makes it resistant to so many antibiotics and medicines. Um, so he cleaned it out, and they had me under for a couple days to make sure they'd gotten all the infection. Um, I was able to get out of there with a pretty cool scar and a pacemaker.
Wow.
And then the following year, I had my aorta, I had an aneurysm develop below my renal artery, so they replaced from my renal to my iliacs and did a full abdominal wall rebuild to reinforce from the problems that had happened before. They cleaned out all the junk and were able to reinforce it. And I was good up until 2019 when I had the second dissection. I had a couple eye surgeries in there, which are a result of, in large part, Marfan related as well. I've detached both my retinas.
Mm-hmm. I
So
mean,
it's been an interesting journey.
no, absolutely. And then we really appreciate you walking us through that and I guess kind of using your experiences and speaking openly about it to help educate a lot of patients and caregivers.
I'm
Um,
a very big fan of there's as many people will tell you I'm kind of like a cat or I appear to have 9 lives. Well, I think that there has to be a reason for it. And I would much rather be able to answer questions and help, especially those in the medical community, understand the viewpoint of someone who's gone through it and the struggles of someone who's gone through it so that they can help not just my daughter, God forbid she ever needs to go through some of the same surgeries, but she may, and other patients. It's uh, some good can come of this. I think it's definitely been difficult at times, but it doesn't have to be. It doesn't have to be a bad thing.
Absolutely. And I think you continue to show that time and time again. Um, it seems like a lot of your throughout your journey, you've been very well informed about Marfan syndrome and sort of the risk factors that come with it. You knew when you were having your dissection. You knew when things went wrong. You knew when you were having sepsis. What do you think is the importance of patients being informed of their conditions, and on the flip side, doctors and physicians making sure that they're speaking about these conditions in a way that everyone understands so that they can inform one another when they go to the ED or when they're feeling symptoms.
You've got to be informed of what's going on with yourself so you can self advocate. I firmly believe that doctors go into this because they want to help people, but they can't know everything and they can't know your story because I know they want to, they'd love to be able to know every patient uh, and every detail, but they can't. It's just impossible. So the more you know about yourself and can help self advocate and be educated as to what's going on, you can help with the process. You're part of the process. And I think it's a fine line between, it's not even a fine line, it's a very thick line between being able to self advocate and being a pain. Most doctors, good doctors, are going to listen to you and work with you and be able to explain things in a way that you can understand. As many patients as I've worked with, and it's kind of funny because a number of my surgeons have, with my permission, shared my contact information with other patients as a, if you have questions, if you want to know what you're getting into and want an opinion on my work, talk to this guy. And they know that I'll tell another patient both the good and the bad, that I'm not going to be a 5-star Yelp review just because.
Right.
I think it's important for people to understand what they're getting into. And you need to be able to tell the doctor that you don't understand what they're saying, and they need to be able to rephrase what they're saying so that you do. You should never let them do something to you that you're not fully vested in. I know a funny story. When I had my first retinal detachment, I had gone in for surgery, and they were talking to me in pre-op about how the procedure was going to go and everything that was going to happen. And I marked on my face with a magic marker which eye it was so that they would know all those things. And the nurse made a comment of, well, if you hear them talking, don't worry, we're just going to twilight you. And I looked at her and I said, well, like hell you are. And she goes, yeah, that's all we do for this. So, well, I'm going home. She, you can't do that. You'll lose your sight. So, well, I'll tell you right now, I'm not staying awake for the surgery. You're putting me under, or I'm going home.
Right.
She's like, well, we can't do that. Let me go get the doctor. And the doctor came in and he said, what's going on? I told him, and he said, okay, we'll knock you out. So I had no problem with it. And it ended up being great that they did, because the surgery ended up being much more complex than they had anticipated. I had complications behind the retinal detachment that afterwards he even told me in a post-op appointment. He was like, it really was good we knocked you out, because we were in there a lot longer than we planned to be. And it shows the benefit of self-advocacy.
Definitely does. And I think you bring up a great point about patients are involved in the process. You're the most important part of the process. So you should be involved in
Yeah.
understanding and making decisions, as you did. um, we have a lot of students on the call with us today, and listeners that will tune in to the recording, uh, who are they're aspiring surgeons, cardiologists, first respondents. What are some things you wish more people knew about Marfan syndrome?
That they're learning more every day, and they're learning it from patients. I really appreciate that doctors are, especially young doctors, are trying to learn more. But it goes back to, you need to listen to the patients, because that's where so much of the great research is coming from, or of how to treat people, not just the medical part of it, but those who haven't dealt with it their whole lives, especially those who get a later diagnosis, are very confused and scared about what they're doing. And if you're able to explain to them and work with them and learn with them, it makes a world of difference to the treatment. One of the scariest things I ever deal with is when I get a new doctor and ask them, or when I have a potential new doctor and I ask them, hey, have you dealt with had a Marfan patient? And some of them, you see their eyes kind of light up, and they're like, oh no, but this is going to be my opportunity to get my name out there and start growing that patient list. That's scary. When you see the ones who, and then you get ones who've dealt with Marfans, and like, yep, I've got a whole bunch of them, very familiar. Um, those are always good to have. The other ones that are good to have are the ones who say, I'm familiar with it, I've never had a patient, but I'm willing to learn and want to go through this journey with you. Those are the ones who are going to reach out to colleagues who have dealt with Marfans, who are actively excited in learning how to treat a patient and be part of the patient care, not just the glory of being on the cutting edge of something new, but more so the glory of being on the cutting edge of patient care.
Absolutely.
Often I go to when I had my mechanical valve, I'd end up in the emergency room, and same thing of always an advocate and always there to help educate. You would have a student who came through that would all, what is that sound? And they'd wonder what that tick, tick, tick is. And my answer is very simple: is if it stops, you screwed up on do whatever you just did. And they'd be like, huh? I'm like, that's my heart. Because so many of them hadn't dealt with an actual patient with a mechanical valve. They'd heard of them, they'd read about them, but to actually deal with a patient with it was a different experience. And it's the same sort of thing with Marfan syndrome. They're, each thing you're dealing with could be different by person. Um, I don't consider my case of Marfan's to be very severe. Uh, I'm not 6'8" and 160 pounds. I'm other than I have a lot of issues, but they're not as visible as many Marfan patients. And people get confused when they who do know about it because that's what they expect. And it just shows that each person's a little bit different, and the conditions that you deal with. Because in addition to the eyes and my obvious aortic issues, I've had a number of joint problems that you don't see because I don't have the super long fingers and appendages. And I have very bad dural aesthesia uh, as a result of Marfan's, which is causes extreme pain. I've just grown used to it over the years. And it's just part of me as a patient.
Right. I mean, I think you bring up a crucial point about what we're so used to reading about it, that we expect real life to mimic that and every patient to look like that, and I think we miss out on a lot of very important learning opportunities and rooms for care when we don't consider that this isn't the same. This isn't not every situation is textbook. So
That
uh,
we expect real life to look like it. That's a great way of putting
yeah.
it.
um, I'm sorry. I know we are approaching 9 o'clock Eastern. I did have two more questions, if it's okay for us to go over a little bit more.
I got all the time in the world for you.
Really appreciate it, Bill. Um, I wanted to ask you about family screening because we hear a lot about that with connective tissue disorders. Have you had any experience with that?
Yes. It's especially interesting because within my family, my kids lovingly refer to me as the original mutant. That no one else within my family has had any, and we've been screened, and my parents were screened. My mom had multiple sclerosis, and that's an entirely different MS. There's no connection between the two. My dad had neither. None of my siblings have anything, but I, as the original mutant in the family, have passed it on to one of my three children. As I told her, don't say I never gave you anything. Valuable life experience is what she's gotten, and it's great. She's actually become a wonderful advocate within the community. Uh, Works very closely with both the rare disease community, the Marfan community, and the uh, Aortic Hope community. Uh, but yeah, family screening is a key because with Marfans, they're learning so much each year, and the approach to it seems to be changing and growing. Um, Working with and observing the Marfan Foundation, there's been a bit of a shift. More connective tissue diseases have, I don't want to say have been discovered in recent years. You have Loeys Dietz, um, Ehlers-Danlos are both very common. Vascular Ehlers-Danlos that you see more about, you hear people mention more often. And they're all very closely related to Marfan's. The foundation has been able to work with these different communities to bring them together kind of under the Marfan umbrella, which allows everyone to work together and row in the same direction. You don't have three, four, five different very similar diagnosis fighting for the same research dollars and for the same research grants and resources, but rather they're able to work together and advance the entire cause. Uh, it's good to see, and they're learning what the small differences are and how to better identify these things within families and communities.
Absolutely. And I think it also builds sort of, like you said, that alliance and kind of discovering the unknown together and
Yep.
finding a way to advocate. And your daughter has a phenomenal role model to look up to. So it's
Thank
amazing
you.
that she's been able to do that so early in life. Just phenomenal work by you and your family. Um,
Thank you.
this brings me to my final question for the evening, and I was wondering if you could share some imparting words about what volunteering means to you, and just how important it is for people to get involved with the mission of Aortic Hope and Think Aorta, well past the month of September.
Well, September is a great time to highlight it, obviously, and you're doing a fantastic job of that. I think
Sure.
I really do appreciate it. It's it's been wonderful being with Aortic Hope since the beginning, watching how much it's been able to grow and spread awareness. There's so many people out there who suffer from aortic diseases that never realized how much of a community there is and how much support there is out there for them to be able to come together and have someone to answer questions, have someone just to talk to who has a shared experience with them. Everybody's experience is a little bit different, but they're also surprisingly similar. When you start talking to people, you realize, like, oh, yeah, that pain, or that's normal, or I'm sorry, I should rephrase that. Thing you realize that something's not normal. I have so many pains and aches and issues that I've dealt with for so long that they're normal to me. They're part of my life. They're part of just, I figured everyone did. And as I start talking to more people within the community, I realize that they deal with it, but they didn't before. And it's like, then we start talking to their supporters who don't suffer from these ailments. And they're like, no, guys, that it's not normal to have that happen. Like, my daughter and I both wear glasses. So when we drive, we always have the little lights from other people's lights. It wasn't until I was talking, my son made a comment about it. And I was like, yeah, everybody sees that. It's like, no, they don't. What, really? And some of the with Marfans, we have what we call Marf tricks. If you're going to have an ailment, you might as well have some fun with it. And since there's a lot of hypermobility, we'll get groups of people together and someone will sit with their foot backwards. None of us really think anything of it till someone walks by. It's like, oh my God, how do you do that? It's like, what? You
Showing
can't
off.
do that? Yeah, so it's great for being able to take the stigma away, to being able to support the community and get word out there and talk to people. It takes away stigma, it takes away fear. It helps people realize that whatever this ailment is and how awful it is, especially with a dissection and how quickly it can come on and change or end your life, the life is going to go on and it's still going to be positive. It's all about what you put into it. It's I tell people all the time that any sort of recovery is dancing. There's some days you're going to take a couple steps forward. There's some days you're going to take a couple steps back. The key is to just go with the music and make sure you have good partners to do it with. It's I relate it to these issues, but it really works for everything.
Incredibly said. And I really, on behalf of the entire TSMA community at Aortic Hope, I want to really thank you for taking the time today to sit with us, share your story, be vulnerable with us, and also really hopefully inspire a lot of students and young trainees to get involved with advocacy.
Excellent.
Do you have any closing remarks for our audience, Bill?
If anyone has any questions or follow up, I can be reached through Aortic Hope. Actually, Bill be at aortichope.org. And it's on, I believe it's on our website. And I really do appreciate the work you all are doing and I wish you the best in trying to continuing to provide wonderful service to the patients and grow this community.
Thank you, sir. And thank you for all your advocacy and insights. Have a great evening, everyone, and thank you for tuning in.
Thank you.
Take care, Bill.